Hey, it's Jamie from thedailyinfusion.com, where you can learn how to reclaim health, create wellness, and transform your life. Today, I'm really excited to welcome my guest, Tami Bronstein, who is a medical herbalist and the founder of the medical herbalist Apothecary. She holds a Bachelor of Science in Physiology, Exercise Physiology, and Phytotherapy, which is known as herbal medicine, and as well as completed extensive training in Neuro-Endocrine physiology of disease and the treatment of it using plant-based medicine. Welcome, Tami.
Hey, Jamie. Thanks for
Yay.
having me.
I'm so glad you're here. So I would love to know a little bit more about how did the medical herbalist apothecary come to be, and can you tell us a little bit more about what you do?
Oh, wow. That's a really loaded question,
Yeah.
but I'm sure we'll have lots of time to talk about it. Basically, the medical herbalist apothecary began as Sundance Wellness almost 20 years ago. And when I went to school overseas and through the medical training, came back and I needed a name for it. And because Sundance Wellness, while it sounds lovely, it didn't really convey what I offer to people. So it's
Right.
relatively new addition of a name, but it's still the same practice, and it is still the same service of healing.
Great. And what kind of conditions do you see people that you serve? What populations?
You know, the thing about the neuroendocrine concept is that it's the brain and the body orchestrating all metabolic functions, all cellular metabolic functions. So it's general medicine. It's basically anything you would take to your general practitioner. So it can range from acute problems to chronic issues and chronic illness. And it can be used by itself or in tandem with conventional treatments. So it's not one or the other.
Right.
We certainly can support synergistically, because there are many people who are on medications that must be on certain medications. There's a place for both. So my role is really a bridge,
Right.
but the name itself came after years of people not quite knowing what it is that I offer. Wellness is really broad, so that's where the name came from.
Right. So, can you tell us a little bit more about neuroendocrine medicine? So, you've had a lot of extensive training in this, and hormones and the balancing of the neuroendocrine system and recovering from disease is so crucial. So, can you tell us why?
I think that people confuse they confuse when they hear hormones, they think of reproductive hormones. But really, when we're talking about hormones, it is the neurotransmitters in the central nervous system and the autonomic nervous system, and the way that they regulate the body through the endocrine organs and the endocrine hormones. And we have a cycle. So the brain signals to the endocrine organs to regulate the body systems. And then we have what we call negative feedback loops to the brain. And that doesn't mean negative in a bad way. It just means that the body will sense what's going on in the system, and it will upregulate or downregulate from the central nervous system, and what we'll call the autonomic nervous system. So it's functioning to keep us at rest, and it's functioning when we're forced to respond to a stressor. Uh, some stressors are ongoing, and some stressors are an acute response. So if I were to hear the fire alarm, I would have to jump up and run out of the building. And so the endocrine system, neuroendocrine system, would adapt to my body's demands. But we also have the same fight or flight response to stresses in life.
Right.
And really, when we talk about stress, it's not just emotional, situational stress. When we talk about a stressor in the neuroendocrine concept, it can be something as simple as waking up in the morning. That is a stressor, it's a normal stressor, but that's what happens. We have a stress response in order to awaken in the morning. So when we talk about stressors, it's important to note that it's not just the stress of your job or your home or situational, but it is normal stressors that we must adapt to. So it's the adaptive process. We always talk about balance. You hear everywhere online, everywhere in the world to find balance. And really, balance is found in the ability to adapt to stress and to recover from stress. So it's kind of elusive, and I think people are frustrated at the thought that they don't have balance. But the truth is that it's your ability to adapt to stress and to recover from it. So,
Right.
yeah, and it's not just reproductive hormones. The neuroendocrine concept is everything from the adrenal glands through the reproductive, thyroid, and ultimately pancreas, and what we would secrete from pancreas, which would be insulin.
Right.
So it's all about timing. It's all about timing.
And so now, what happens then to our hormones by the time we get to a place of a chronic condition or disease when you see some of the more complex issues? What's going on there with our bodies?
Well, when there is a chronic imbalance, the body goes into what we would call a general adaptation syndrome, which means that there are uh, certain transitions in life that our bodies change and we don't go backwards. So puberty, menopause, these are transitions that the body goes through, and the neuroendocrine system adapts to the change, and we never go backward. So we don't go back into puberty. Once we go through puberty, our bodies have a new way of functioning. But when you're under stress, when you're under chronic pain, chronic illness, the body does have to adapt to this ongoing stress. So it's almost like, and I explain to people, it's almost like withdrawing money from the bank. If you withdraw money from the bank and you don't put what you need back in, you go into debt. And
Yeah.
eventually you have to pay that debt back. But the body does continue to function. It finds other pathways to function. So it's like getting a credit card. If you don't have money in the bank, you get a credit card and you find the funds to do what you need to do. And the same thing with the body. And I'm going to use the adrenal glands as an example. If you keep demanding your body to respond to stress, which includes cortisol, epinephrine, norepinephrine, all of these adrenal, or what we call adrenaline. If we are constantly drawing from the bank and we don't put those funds back in, we go into a sort of deficit. So you can't get funds if they don't exist. So you can't get the stress response properly. Your body will find a way around it, but it's not ideal. And so you have problems with that come along with that.
Right. And how does that affect the progression of disease? What does that mean for us?
The progression of disease. Well, you do have cellular changes. You do have effects on DNA and the body's resistance to additional illnesses. So when your body's immune function is compromised, you can succumb to secondary infections. You don't have the proper resources to provide certain hormones to keep the body in optimal health. So it's a slow drain on the system. Sometimes it's a fast drain if you're in a very compromised condition. So, it does affect over time.
So, can you tell us what's going on in cases such as something like Lyme disease? What's happening to the body, and what does it mean in terms of treatment and the complexity and the really subjective nature and individualized nature of this situation?
Every case of Lyme and Lyme-related co-infections presents differently. And I'm specific to say Lyme-related co-infections because it's not just Lyme. And when you go to the physicians, you do need to request that they test for other bacterium. And that's where a lot of people are missing the mark, because if you're treating just for Lyme disease, but there are other related bacterium like Babesia, Bartonella, Ehrlichia, there are other bacterium that are very similar, and they present with very similar symptoms. And they can be, it's interesting. I did have a patient who we had worked with. He's an avid bird watcher. And so he's always out in the woods, and this one particular patient. And we worked with him, and he went into remission, and everything was great. I didn't see him for 3 years. He was subsequently bitten again and reinfected. And this happened a couple of times. 2 times were reinfections. One time was just a resurfacing of symptoms, and that can happen in third stage Lyme and Lyme-related infections. In one of his episodes, he found a new doctor who tested him for Rocky Mountain spotted fever, and now he lives in New Jersey. We're not in the Rocky Mountains. Most doctors wouldn't think to test for that, and so his course of care had to change direction to accommodate the new bacterium that he was dealing with. But we call it related co-infections because they have very similar cyclical experiences. So you'll often see 3-week cycles, and that's because, and you would know, and most of people who follow you would know, is that you go through different stages of the bacterium. You have larval stages and the adult stage. So you have dormant infections that hide. They develop a cloaking mechanism that the immune system doesn't recognize it, and so it can remain dormant. And when they're active, they go through these different stages. So that's why it takes such a protracted span of time to rein it in, because they adapt and they hide. They adapt to the medication. And then you have this cyclical nature that you have to address the active adults, but then you still have the replicated bacterium. So it is a frustrating experience for people, because their symptoms can be very different from one another. Some people have very extreme neurological experiences, vision loss. It can affect walking. Some people can be misdiagnosed with multiple sclerosis. So it's a very difficult healing process for most people that have Lyme or Lyme-related infections. And sometimes the side effects from the medications is pretty significant as well. Now, in acute cases, if they get the antibiotics straight away, many people don't have any future problems. But unfortunately, there are a lot of people who don't suffer from the bullseye rash. They don't know that they were bitten. They might suffer some mild flu-like symptoms early on and sort of discount it until 6 months later. And then they start to have those second and third stage symptoms. So it's a very frustrating for a lot of people. With the way that I would support them, obviously it depends whether, every case is different. So some people are going to be on medications. Some people were on medications and then discontinued. Some reached the end of what conventional practitioners could provide, and they were still symptomatic, and the doctors really had no means of advising them further. And sadly, other people report not being listened to once they've gone through the course of very strong medications. And one thing that's important to remember is that in conventional chemotherapy for cancer patients, they use very high dose antibiotics in addition to cytotoxic medication. And so you can imagine people that go through cancer have a lot of side effects from the medication. So you can imagine that people with Lyme disease and Lyme-related infections also have significant symptoms just from the medication. And so I'm supportive of both. I don't want anyone to feel that there's any judgment from my end, and I'm very open to working alongside their physicians.
Right.
So sometimes I take a primary role, and sometimes I take just a secondary supportive role. So it just depends on the individual and their other treatments that they're enduring. And so obviously we try to keep the bacterial load down. We look to support the immune system, but it's important to remember that we don't want to stimulate an already overstimulated immune response. So like I said, it can be pretty tricky, and every case is different. So if somebody has an active Lyme infection and they have these abnormally high immune response to navigate it, you certainly don't want to overstimulate that. And so we look to modulate the immune system. So it's a matter of understanding the individual's medical history and their symptoms, and to know that not every case is the same. No two people get the same approach. So I think that would sum it up.
For sure. And I should mention that the way that there's a coincidence between the two of us, which is that I actually went through the IV antibiotic treatment route for my Lyme disease treatment. And they ended up not being the answer for me in terms of what to continue on with at this point. And I ended up going to an osteopath named Dr. Habib Sadeghi, who you studied with just by coincidence. So could you tell us a little bit about what I'm doing with Dr. Sadeghi, what that you do?
Well, we met in the same postgraduate studies with the doctors from Paris, France. We met in San Diego. I had begun my postgraduate work with Dr. Lapraz in what he calls endobiogenic medicine. And I went to Middlesex University in London to study with Dr. Lapraz. And we continued the studies here stateside. And in a room full of doctors, I met Dr. Sadeghi, and through one of our colleagues as well, who runs the American group of endobiogenic medicine practitioners. So yeah, we both met, and it's once you learn the concept, which takes conventional medicine and it brings it full circle. So you don't just look at the thyroid function on its own. You see what feeds into it and what it then supports. Everything has timing. And the model is based upon these axes that come from the brain to the body. So at the level of the hypothalamus and the pituitary gland, it regulates we talked about the endocrine system. And everything has proper timing. And when that timing is off is when imbalance surfaces. But now you present a stressor like a bacterium, like the Lyme disease, and it becomes a whole new ballgame. So, but the crux of the concept is to give the body what it needs to balance itself. You know, we're not supplying hormones; we're supplying plants that will give the body what ultimately will help to balance itself.
So And now I want to be clear though, this is potent medicine that you're treating with.
Absolutely. I mean, conventional medicine, just like aspirin, was based on the willow, white willow,
Mm-hmm.
and the bark of the tree. Um, Conventional medicine was based on plant medicine in many cases, and then synthesized into a synthetic compound. The benefits of using a whole plant is that you get the active constituents, but you have an array of additional components that help it to modulate in the body, so you don't have that same effect of isolating compounds. Um, and it's interesting because Dr. Lapraz, Jean-Claude Lapraz, who developed this work, gave up his conventional practice probably over 40 years ago, and has traveled the world teaching medical doctors this form of evaluation and treatment. So it's really profound. And so I had the basic qualifications with the University of Wales and the College of Phytotherapy. But when I started doing this neuroendocrine work with Dr. Lapraz, it was profound. And once you open your mind to how every neuroendocrine function is integrated with other functions, you realize that the thyroid, you can't just look at the thyroid, you have to look at what happens before it. When somebody, let's say, has a thyroid dysfunction, you can give it medication to balance the end unit hormone, but you also want to look at why is it imbalanced. If it's an autoimmune disorder like Hashimoto's thyroiditis, that would be a genetic marker that attacks the body. It's an autoimmune disorder, and the body attacks the thyroid gland, and you have peaks and valleys of thyroid hormones until it just exhausts itself, and most people go into a hypothyroid condition. But there are a lot of people who have they're symptomatic of thyroid, and they come to me and they say, I have all of the symptoms of low thyroid, but the doctor tested me and my thyroid is fine. And so you realize that there are people sensitive to variations within the normal range. So you really take a look at what is feeding into that. And it's the axis from the brain to the body that comes before it, which is the reproductive hormones. So you often see menopausal women who are starting to experience thyroid issues, but really what we need to look at is the reproductive. Or for people who are under chronic stress, or with improper diet, lack of sleep, things like that, that are draining the adrenal glands. Now, the adrenals feed the reproductive hormones, which then feed the thyroid hormones, which then feed the pancreatic hormones, which ultimately is insulin. And so what we find is everything works together, and you don't just look at the one, you really look at the whole. I remember Dr. Lapraz always saying, you have to think globally.
Nah.
You have to think of the entire person, the entire picture. And and that's really profound. You're not just looking at a number scorecard. You're not just looking at the fact that the person has high cholesterol. You're saying, what's causing that? Is the thyroid functioning properly? Because the thyroid regulates metabolism uh, of cholesterol, and so we look at many factors. You have to think globally.